Thank you everyone for your attention. My name is Edward Whitlock, and I'm here representing Mountain Vista Direct Medical, MVDM, Utah County's premier direct primary care provider. I'd like to take a few minutes to share with you what direct primary care is, why you'll want to know more about it, and how we can help your business save big money on your total cost of healthcare for your employees. So stay with me. So, how does healthcare work today? Well, it's a pretty complicated insurance based fee for service system. And in this system, the federal government, through Medicare, sets the rates for how much doctors and hospitals get paid for everything they do. Congress, meaning politicians, oversees Medicare, and political action committees or PACs pay big money for these politicians to get elected. The companies funding these PACs and politicians spent $714 million in 2020 lobbying Congress, more than any other lobbying group in America. Why? Because they want a return on their investment. So they've lobbied Congress into supporting a reimbursement system that's based on generating better returns for stockholders and investors, not on actually taking care of people's health. Insurance companies and HMOs collect billions in premiums from employers, individuals, and governments, and reimburse providers who deliver care to their insured populations. But they act as financial gatekeepers and administrators that control doctors and distort the true costs of healthcare, since over 40 cents of every dollar spent on healthcare goes toward insurance billing and overhead. These middlemen all stand between a physician and their patients, creating rules, regulations, bureaucratic red tape, and driving healthcare costs higher and higher, and they make billions doing it. In other countries, healthcare professionals are paid to keep people healthy, but in the US, healthcare professionals get paid for doing procedures and tests and medications and operations that benefit suppliers. In other words, they get paid for sickness, not for health. It's a corrupt system of perverse incentives. As a result, primary or preventative care gets paid very little, while surgeons, hospitals, and pharmaceutical companies get paid a lot. All a patient really wants is to be taken care of by a doctor they can trust. But what we have is a system in which the patient physician relationship has been severed. So, how on earth do you change the system? Well, MVDM has the answer: direct primary care. It's a model for healthcare that breaks down the barriers of the existing system, makes it simple, and returns it to its roots, the patient physician relationship. The entrenched players in the current system are satisfied with the status quo. So it's not about fighting them, it's about making the existing model obsolete. Before this convoluted fee for service system of medical insurance became the norm, the family doctor was your first call when you or your child had a fever, twisted an ankle, or simply needed a checkup. Your doctor always made time for you, even after hours and on weekends. And if you were too sick to make it to the doctor's office, a house call was often the next logical step. Direct primary care healthcare represents a welcome return to this highly personalized approach to primary care. In the direct primary care model, patients contract directly with their physician for their primary care for a small monthly fee that replaces the traditional system of third party insurance coverage for primary care services. DPC gives you direct access to your physician and to care that incorporates today's technologies, therapies, and wellness strategies to keep you healthy. Now, the current healthcare system is working pretty well for government, insurance companies, hospital systems, the pharmaceutical industry, the AMA, and other medical organizations, and so on, since it generated $3.8 trillion, or over $11,500 in spending for every person in the US in 2019. So it's definitely big business. But it's not working so well for patients or physicians, or even for you as business owners that have to bear a lot of this cost in the form of healthcare benefits for your employees. So you should ask, what exactly are you paying for? Keep in mind what I mentioned earlier, that in this fee for service system, over 40 cents of every dollar you spend on healthcare goes toward insurance billing and overhead. And with the cost of healthcare outpacing inflation, you're spending more and more on it every year. And what that means from your physician's perspective is that he or she is forced to maximize the number of patients seen every day just to make ends meet. And because doctors have to become bean counters in an insurance based model, here's what happens: your doctor isn't immediately accessible. You may have to wait weeks just to be seen, and once you are seen, you'll probably have a lengthy wait in the office before you can visit with your doctor. Then, once you finally get to see them, you'll probably only get less than 10 minutes to actually talk with them, so you may not even get to discuss important questions and concerns or dig into deeper issues and address them. Or your doctor may default to writing prescriptions that alleviate symptoms while not addressing the actual cause, or refer you to somebody else for additional tests or services just to try to stay on schedule rather than take the time to determine what's really going on. And if you do really need additional services from a specialist, your doctor simply doesn't have the time to be your advocate or help you navigate the system to get the best care available as soon as possible. On top of all that, because your doctor needs to comply with regulations and get paid through the insurance system, he or she will end up spending on average twice as much time on paperwork as they did actually talking with you. And not only that, but since there's typically no price transparency at all, you won't know until you get a bill just how much your visit cost or how much your insurance actually covered. You don't have a trusted relationship with a doctor who cares about managing your care. You have a transaction that you don't really even know the terms of. So, what this kind of an experience leads to for many people, because it's such an expensive, inconvenient hassle, is just avoiding healthcare as much as possible, abandoning regular checkups until things get bad enough that they feel like they have to go see the doctor or else, letting what could have been something minor turn into something major. That, from your perspective as an employer, ends up in poor performance on the job or absence from work altogether, which can directly impact your bottom line. In fact, you may even be doing this yourself. So let's talk about direct primary care. How's it work? Well, to put it simply, it's kind of like a gym membership, but for healthcare. You, as a patient, pay our direct primary care clinic a monthly membership fee to get unlimited direct access to your physician, including through in office visits over email, text, or phone calls, or through video calls or even home visits for an additional fee, as well as access to an array of the most common medical services, including labs, imaging, and medications at up to 90% less than going through insurance, and all with no copays or deductibles. And on top of all that, you'll know exactly how much any service will cost before it's done. How can we do it? Because instead of dealing with costly overhead and insurance, we cut out all the middlemen and reinvest that 40 cents into our clinic, in electronic medical records, in patient services, and in freeing clinicians from paperwork. So you get to experience short to no wait times, much longer appointments, and much lower costs, along with having the time to build a trusted relationship with a doctor who knows you and who is proactive about managing your personal care to keep you healthy. As a result, the money you save on healthcare will more than cover the cost of your monthly membership. Study after study has shown that primary care saves money. It's an investment in your health. And at a cost of $60 per member per month or less as an employer, direct primary care can cost less than your average monthly mobile phone bill per employee. So let's be clear, MVDM Direct Primary Care can save you big money. Case study data collected over several years from numerous businesses that have integrated direct primary care into their healthcare benefits packages shows that the average total cost of care was reduced by up to 35% within just 2 years. That's a savings of 1/4 to 1/3 of your total cost of care for your business. That's huge. Studies also showed significant decreases in employee visits to the ER, days spent in the hospital, referrals to specialists, and surgeries performed, all because of an increase in primary care visits to a trusted primary care doctor who was able to resolve their issues without requiring additional care or expense. So, what's the bottom line for you as an employer? Direct primary care for your business means your employees have access to managed personal health care with better health outcomes that results in less sick time and absence from work and more productivity from healthier and happier employees, with an average savings of almost $1,500 per patient per year compared to the fee for service insurance based model. Our team has a combined 40 plus years of experience providing exceptional individualized primary care, and we are laser focused on making healthcare accessible and available, affordable and price transparent, and on building long term relationships of trust with all of our patients. We value your time, we value your money, and we value your trust, and we look forward to working with you to craft a better healthcare solution for your business that saves you money and takes much better care of your employees. Thank you for your time, and please don't hesitate to reach out to us for more information.